Hi, I'm Jennifer Marvin, a volunteer with the Eastern Shore office of the Alzheimer's Association. And today I have with me Nancy Rodriguez Weller, a registered pharmacist and an assistant professor from the University of Maryland Eastern Shore School of Pharmacy and Health Professions. She's also a fellow volunteer of the Alzheimer's Association. June is Brain Awareness Month, and so Nancy will be sharing with us some important information related to medicinal and non medicinal approaches to Alzheimer's disease. Welcome, Nancy.
Thank you. Thank you for having me.
So, first, could you tell us a little bit about what Alzheimer's disease is?
So, Alzheimer's disease is the sixth leading cause of death in the United States right now. It is a neurodegenerative disease, and that means that it affects the brain and affects memory, thinking, and behavior. This disease was discovered almost 100 years ago, 1907, by a gentleman named Alois Alzheimer. And one of his patients, a young patient at the age of 51 years old, exhibited some of these signs that we just discussed, the memory impairment, problems with thinking and behavior. And when this patient passed away, he studied the person's brain and discovered that in between the neurons there were either plaques or tangles or markers that were pretty significant. And so the disease then was named after Dr. Alois Alzheimer. And this disease affects mostly people over the age of 65, but there are a few young people that do experience or are diagnosed with Alzheimer's disease. It affects 5.3 million people in the United States. But what's scary about this disease is by the year 2050, there are potentially going to be about 16 million people diagnosed with Alzheimer's disease.
Wow, staggering statistics.
Oh, absolutely, yes.
So, Nancy, could you tell us maybe a little bit more about the stages of Alzheimer's disease and what the medications look like in those different stages?
Yeah, so early on, the symptoms of Alzheimer's disease are pretty vague. I mean, you know, we may forget where we placed our key, but that doesn't mean that you have Alzheimer's disease. Early on, family members may notice things like, for example, not recognizing either a person that is a family member or maybe not knowing what that key is for. So this leads a family member to take their loved one to a physician because normally that person who is starting to exhibit those signs and symptoms of Alzheimer's disease may not recognize that he or she actually is having some cognitive issues. So what happens early on is the physicians may do a little test called a mini mental test. And in that mini mental test, then the physician will determine if the disease is mild to moderate or moderate to severe. And again, this is a progressive disease. So how we treat it is going to be slightly different. In mild to moderate diseases, a disease process of Alzheimer's disease, we would use one of the cholinesterase inhibitors that we talked about previously. And as the disease progresses to maybe the moderate to severe stage, this is when we add the second medication, the anti-glutamatergic. And typically, these drugs are started very low, at doses very low, and then tapered up to keep the patient at a maintenance dose. And the reason we do that is because of the side effects. We don't want a patient to exhibit side effects early on and then not want to take it. We want them to start low and then build up the dose. And then monitoring is very important thereafter. As the disease worsens, there are some clinical controversies about choosing whether to keep people on the medications. Because one of the things that does occur as it becomes severe, people with Alzheimer's then have difficulty swallowing, or they have a complete disinterest in eating. And so clinicians have to make a choice of whether or not they want to discontinue at this point. Some physicians believe that they want to keep their patients on these medications for as long as they can. And in some cases, others believe that it's so severe that it's not going to make any difference.
Thank you for sharing that. Are there any medications that are available for someone diagnosed with Alzheimer's disease?
Yes, but I want to stress that Alzheimer's disease cannot be cured. The medications that we use, the primary goal is to extend the function of the patient's ability to do things of daily life, like getting dressed and being able to eat and function, pay bills. So the goal of therapy is to treat two different types of symptoms, either the cognitive symptoms or the non-cognitive symptoms. To treat the cognitive symptoms, again, there is no cure. What these medications do are basically slow the progress of the disease so that the patient can continue to function with their daily lives. So in this category, to treat the cognitive symptoms, we use a term called cholinesterase inhibitors. It kind of alters some of the chemical stuff that causes Alzheimer's to occur. And these drugs include drugs like donepezil, which people may recognize under the brand name of Aricept, rivastigmine, which as the brand name is Exelon, and galantamine, which the brand name is Razidine. The second group of drugs are the anti-glutamatergics, and there's only one in that category. This one can be used either in combination with the other ones that we talked about, or it can be used alone. It is called memantine, and it is known as Namenda. And these medications are typically, again, used to treat the cognitive portion of the disease. The non-cognitive symptoms, such as the depression that's associated with the disease, or the combative behavior and the restlessness and nervousness, is treated by using either antipsychotic drugs, or you can use drugs to calm the anxiety down. You can use antidepressants to keep the patient from becoming depressed. So basically, that's what's available right now to treat the disease symptoms.
Okay, great. Are there any side effects that we should be aware of?
So these drugs that I just mentioned, the first category, the cognitive medications, side effects are pretty mild. They tend to, patients complain of maybe insomnia or restlessness. They may complain of headaches or dizziness. There's one medication in particular that may cause a drop in pulse. And so sometimes we as clinicians have to monitor that patients don't have falls. With the other type of medications, it's again, they're not permanent, and as all medications are, they all have side effects. But most important point I want to reiterate is that these drugs just have to be monitored.
Okay, great. Other than medicines, are there any other approaches that you would recommend?
Yes, and so education is one of the things I first suggest, and that's educating and understanding what's happening with the patient and what to expect. And this is both a recommendation for the patient and for family members. Understanding what's going to happen in the long run. So as a social worker, I know you understand and would help us in in guiding patients to discuss tough subjects,
Mm-hmm.
like what are they going to do about their finances in the long term? What are the things that you may have to decide in terms of the clinical aspect of it? Do you want to have someone responsible to make medical decisions for you? The other thing that we recommend is thinking about diet and exercise as part of the non-pharmacological approach as well. If a patient does have Alzheimer's disease, approaching them in a non-confrontational manner. And again, you have to think about all the different stages that the patient may be going through. Never give a patient who has Alzheimer's disease uh, tough things to do. Like, for example, Dad, can you get dressed and put your pants on? You kind of have to give them instructions one thing at a time. Put your shoes on first, and then tie your shoes. So make these instructions or commands very simple. And the other thing is just, paying attention to little things like pain and maybe disorientation, maybe because they're not familiar with where they're going or what they're doing. Keeping the command simple is the most important thing. Keep in mind that most older adults also, because we are getting older, we may lose hearing and have visual problems. So keeping that in mind, that kind of complicates things in a patient who has cognitive issues going on as well. So
Great. Those are all great suggestions. Thank you.
mhm.
Yeah. So I know that older adults are often prescribed many medications at the same time. Could you talk a little bit about that as it relates to Alzheimer's disease?
Yes. So older adults are very sensitive to medications. And it's very rare to have an older person maybe on one or two drugs. So the more medications an older person has, the higher the risk for drug-drug interactions and also problems with confusion and dizziness, because some of these medications can cause impairment. So one of the first things I do suggest is having clinicians look at what that person's medications are before making changes or adding other medications. So yeah, polypharmacy is a really big deal.
So, how often would you recommend that Alzheimer's patients be reevaluated by their physician for the medications that they're prescribed?
So as soon as they recognize that there is something going on with mom or dad or a loved one, that it's important to try to treat the disease early on. This disease can affect people as young as 51. And believe it or not, recently there have been some studies saying that the the true progression of the disease occurs 20 years before we even see the symptoms. So very important to try to have that loved one seen as soon as the symptoms become apparent. And thereafter, it might depend on the physician, on what he finds with that initial evaluation. I typically recommend the patient who is in a long-term care setting have that exam done either every 6 months or every year, depending on what's going on with the patient during that period of time. Some patients may have that disease progress very, very fast. Others have the disease progress very, very slow. So keeping up with what's going on with the patient has to be discussed with the clinician.
Great, thank you. So people always want to know, how do I reduce my risk of developing Alzheimer's disease? Do you have any suggestions?
Yes, and in fact, yeah, my father was diagnosed with Alzheimer's disease, and I'm very cognizant of some things, like for example, diet. Am I eating the right foods? It's recommended to uh, have a diet low in fat, low cholesterol, eat healthier vegetables, dark vegetables, fruits. Um, Maintaining vascular health is another thing that's highly recommended, and that's making sure that your blood pressure is being attended to, especially if you are already diagnosed with hypertension. Um, the other thing is keeping your blood sugars monitored, as well as, again, diet. And so vascular health, repeating myself, is very, very important. Maintaining a healthy lifestyle, keeping active, hobbies, doing different things. And I want to add that people don't think about this, but music is absolutely wonderful in an Alzheimer's disease patient, as well as for you who, music is very stimulating to the brain. So that's another thing that can be uh, approached and thought about as a thing that you can use to help in preventing Alzheimer's disease.
Wonderful. Thank you. Interesting. So is there anything else that you would like to share with the viewers about this disease?
So in 2012, the Obama administration allocated about $156 million towards preventing Alzheimer's disease. And the goal was to hopefully find a cure by 2025. The most important thing I want to point out is that pharmaceutical companies have been on board about trying to find a cure. In fact, I guarantee you that they're all fighting to be that one company that finds the cure to Alzheimer's disease. The At this present time, we have a lot of drugs in the clinical phase 3 stage of research, and so there's a lot of hope. There's a lot of hope, and we will find a cure for Alzheimer's disease.
Well, thank you, Nancy. This has really been very informative.
It's my pleasure, Jennifer. Anything that we can do to enhance and help with educating our public about Alzheimer's disease is very, very important to me. Thank you.
Also wanted to let the viewers know that the Alzheimer's Association has a lot of support and resources on their website, alz.org, and those who have been diagnosed or who are caring for someone with the disease, they have a 24/7 support line. That number is 1-800-272-3900. Again, that's 24/7. Anybody can call and access that support. Also, if you're interested in supporting the mission of the Alzheimer's Association, which is a world without Alzheimer's disease, please join us on November 3rd at the Mack Center in Salisbury for the Walk to End Alzheimer's. You may go ahead and register your team at any time online at alz.org, act.alz.org. Thanks for watching.